Hi, this is Dr. Kim, your favorite Dr. Kim, talking to you about the best fillers for you. So as you probably know, fillers are wildly popular. They're typically given to the face, occasionally in the face and other body areas. So fillers have different chemical structures, which we'll get into in just a moment, and they can actually give you volume. They can augment. I don't think they really lift, but rarely I think they can lift in certain areas of the face. So what are fillers? They're really meant for static wrinkles. They're meant for areas of the face and other areas of the body and hands where you have a depression. The muscle is not necessarily causing the wrinkle or the depression or indentation, rather you simply have it. Common areas include your face and specifically your cheek, where over time your cheek doesn't really have that youthful rejuvenated look, rather it starts to sag a little and you lose volume in your cheek. So we can actually give you more volume with filler. Another common area is the nasolabial fold. Specifically, this area, or the parentheses lines, do become more noticeable with time, and we can help fill that area. Another fascinating and fun-filled area are these lines. So some people call them jawlines. A not very PC term is called the marionette lines, where you look like a puppet or marionette as those lines become deeper with time. Finally, we can actually reshape or sort of sculpt your face, including giving you filler in your jawline to give you a sharper jawline. We can give it to you in the under eye, including the upper eye or lower eye, depending on what you need. So what's the right filler for you? The second thing is, of course, the chemical. The world's most common chemical is HA, or hyaluronic acid fillers. The reason for this is that they're very forgiving. They can be melted or reversed if needed. And finally, since all humans have some type of hyaluronic acid, they, we think, have less of a tissue reaction in general compared to other fillers. So since they're very forgiving, easy to use, and meltable, they are by far the world's most common fillers out there. There are other chemicals including CAHA, calcium hydroxyapatite, and other chemicals which we'll get into in a completely different video, but those are definitely less common. So how long do these fillers last? Typically about 6 to 12 months, more around the 12-month range. They vary because it depends on the cross-linking, the exact chemical structure, and interestingly enough, depends on where they're injected in your face. Usually, if a filler is injected, it should last around 12 months. That's often what the box or FDA label states. However, the more you move a facial area, the shorter the length of duration. If I give the exact same filler close to the mouth or in the lips, it will not last as long as if I give it to you in the other area of the face where you have less eating, movement, human emotion, things of that nature. There are fillers that last longer, and we'll get into that in a different video, but they're typically a different chemical. There are also human or individual variances. Your metabolism may actually absorb that filler faster than other humans. Sometimes we think that if there's some stress involved, you can have more faster resorption of that filler. There are safety concerns with fillers, of course, just like any medical procedure. I think the biggest ones include vascular occlusion, where if someone gives you a little filler in a tiny blood vessel, that can actually stop blood flow in that blood vessel. And if it's one that's reasonably big, it can stop blood flow in a certain facial area or anatomic area of your face. Fortunately, this is rare, but it can happen, which is why it's important to pick the best injector for you. There are reversing agents which help immediately, which every injector should have, and I have it in my office. So those are the things that really help reduce the risk of vascular occlusion. Another rare reaction can be a tissue reaction where a filler is given safely, however, your body may react to it. We think that's related to biofilm or bacteria getting onto the actual filler. This can be negated or it can be reduced by making sure that the area is very clean before you get an injection. And fortunately, melting it seems to really help. Both of these complications, which are big ones, are very rare, which is great. A third concern is, of course, the exact type of filler, because all these names are very confusing or bewildering. With Allergan, their brand name is Juvederm. Now they have several types of Juvederm filler available, which we'll get into in a different video. Just be aware that even though Juvederm is sort of their global trademark name, they have different fillers for the lips, for the cheeks, for areas that vary on the face. Galderma Their brand name is called Restylane. And again, they have different types of Restylane depending on where it's injected. Also, interestingly, Restylane is FDA approved for the backs of the hands. So if you have thin, atrophic, or really old people hands, we can actually fill it up safely so that your hands look more rejuvenated and youthful. Finally, Mertz, which is not a huge presence in the US, they have a product called Belotero. This is not very long lasting HA filler, but that actually is good depending on the circumstance. So the manufacturer, how long it lasts, even the type of filler depends on really what is best for you and what's best for a specific anatomic facial area. Sometimes it's not just the best filler for you, but it's actually also the amount. Fillers come in syringes, and one syringe is typically about 1.0 cc's. It's pretty exact. So I don't think that every patient needs exactly 1.0 cc's. Sometimes you need more, sometimes you need less. I do think that with my signature full facial optimization techniques, we can sort of overcome the need to always count syringes, but that depends on you, that depends on your body, and that depends on your requirements. And that, of course, is a different video because this is the introductory video. So I hope this introduction to fillers really helps you, and we'll get into other topics in our other videos. So if you have any other questions, please fire away in the comments below. Thanks so much for watching.